One of the short articles in the Veterinary Business News and Views newsletter this month is by Nicole Palumbo and originally published on Andy Rourke's website. You and I both know that the attitude of staff members can have a major impact on the success of any business, particularly on those service industries like ours, which depend on building a professional working relationship with their clients based on trust. What may not be quite so obvious is the impact that attitude can have on the clinical outcome for the patient. The example quoted by Nicole concerned a 10-year-old bitch called Fluffy. Fluffy was in very poor shape and presented with a history and all the clinical signs suggestive of a pyometra. Nicole suggests that the attitude exhibited by the vet and the words that the vet uses in just one sentence could make or break Fluffy's chances of recovery. One vet might say, "Fluffy's really sick and could die even if we operate," in a tone which emphasises the negative. And hearing those words, Fluffy's owners could well decide on euthanasia. Another vet might say, "Fluffy's really sick and could die, but if we operate now, we could possibly save her." That's a tone which acknowledges the negative while offering some hope, a possible solution, and expressing some confidence. On that basis, Fluffy's owners would likely opt for surgery. A third vet might say, "Fluffy's really sick now, but it could all have been prevented. We can try surgery, but she might die." That tone seems to place the blame entirely on the client and almost bullies the client into choosing euthanasia or surgery. Then finally, a fourth vet might say, "I think Fluffy may be really sick. I'm not sure she's going to make it and will probably die even if we operate." All that in a tone which offers little or no confidence in anything that the vet says. Every vet is different. They're people. They're individuals with different strengths, weaknesses, styles and personalities. That's the good news. The not so good news for practice owners is that their employees' individual attitude, what they say and how they say it, can have a profound impact on your clients and the choices they make for their animals and your patients. Successful veterinary practices comprise small teams of professionals with a common objective and a positive can-do attitude. So whatever their individual role, team members with an attitude score of 9s and 10s are the ones to hang on to. 8s might be worth working on, but anyone with a score below that should, in my view, have no future at all in your veterinary practice. See you next time.